In today's class, let us try to learn about a very famous drug, which is minoxidil. So let us try to learn some important points, basic things, pharmacology of minoxidil. See, in PharmD and in pharmacology subject, we deal about this minoxidil in antihypertensive classification. And when we go to hospital, in hospitals, we find very commonly AC inhibitors, ARBs, telmisartan, losartan. Sometimes we find calcium channel blockers, amlodipine, and diuretics, what we say, hydrochlorothiazide. Okay, and in loop diuretics we find furosemide. Very commonly we will be finding only these drugs, but minoxidil as an antihypertensive drug we don't find in hospital. But despite of all these uncommon usage of this minoxidil, sometimes minoxidil has great importance in dermatology department. I will try to tell you about that in detail. Okay, so we will try to discuss about minoxidil pharmacology. First basic things we'll try to discuss, and later on we'll go with pharmacotherapeutic aspects. Okay, see, firstly we already know that minoxidil comes under vasodilators. In the class of vasodilators, minoxidil is one of the example. Okay, see, along with minoxidil we have other vasodilators. We have hydralazine. I think you might have heard about these drugs. We have sodium nitroprusside. Sodium nitroprusside is very very effective drug. Actually, see, एक चीज याद रख लो, vasodilators are used in the hospital only when calcium channel blocker or diuretic or AC inhibitor. When these drugs fails, when this drug fails in treating hypertension, we have to select vasodilators. Number one. And sometimes what happens, sometimes patient will come with hypertensive crisis, emergency hypertension बोलते हैं, emergency hypertension. Patient's blood pressure will be more than 180 by 95 mmHg, 190, 200 like that. So that blood pressure is continuously persisted. ऐसा ही रहता है, कम नहीं होता. So in those cases, we have to follow vasodilators. So one thing, when 2 or 3 drugs, antihypertensive drugs, are not effective for treating hypertension, then we have to choose vasodilators. Or if patient is in emergency hypertension, if patient's blood pressure is in crisis, at the time we have to choose vasodilators. In vasodilators, we have hydralazine and sodium nitroprusside. Sodium nitroprusside is very effective drug. इसके साथ साथ we have the third drug is minoxidil. Minoxidil. Minoxidil is also effective drug, but in hospital we don't use minoxidil as antihypertensive. Okay. Now let me talk about the mechanism of action of minoxidil. Are you all following me? Let's talk about mechanism of action of minoxidil. We already know that minoxidil is a vasodilator. Okay, it is a vasodilator. What is vasodilator? Any drug which dilates the epithelial tissue, or if any drug which dilates the muscular tissue of blood vessel, which relaxes the muscles of the blood vessels, they are considered as vasodilators. Okay. See, यहाँ पे when we talk about minoxidil, what minoxidil does? Minoxidil is a potassium opener. It is a potassium channel opener or potassium opener. When minoxidil is given, what it does? See, we have each and every cell. When we consider the muscle cell of blood vessel, we have circular muscles and longitudinal muscles. You know this point. In blood vessel, we have circular muscles, which are considered as smooth muscles. So these smooth muscles are, have, just imagine this is a typical smooth muscle cell. Okay, this is a typical smooth muscle cell. So on these smooth muscles, we have potassium channels. When minoxidil is given, minoxidil will open this potassium channel, and what happens? The potassium which is present inside the cell will come out. All the potassium will come out. So tell me one thing: when positive ions comes out of the cell, what will happen? When positive ions comes out of the cell, what will happen? Who will tell? When positive ions comes out of the cell, what will happen? Inside the cell, negative ion concentration increases, right? Inside the cell, negative ion concentration increases. That means it is either causing repolarization or hyperpolarization. Hyperpolarization. Polarization. Any drug which causes hyperpolarization, what they do? They will relax the cell or it will relax the muscles. And because of that, the smooth muscles of the blood vessels will relax and through that it will dilate the blood vessel. I think second year students understood the mechanism. Simple. Minoxidil is a potassium channel opener or potassium opener. When potassium comes out of the cell, it causes hyperpolarization and it relaxes the muscle. And when muscles are relaxed, it will dilate the blood vessel. And when blood vessels are dilated, what will happen? What will happen? The peripheral resistance will decrease. When peripheral resistance decreases, it will decrease blood pressure. So in that manner, it is very effective in hypertension. Clear? Now, see, let me tell one very important point now. Minoxidil is a vasodilator. Clear this point. Along with these vasodilatory effects, what minoxidil does, we have to give beta blocker and we have to give one diuretic. अगर किसी भी patient में you are suggesting minoxidil, okay, as antihypertensive drug. So along with minoxidil, always we have to suggest the physician, or if you are prescribing, always prescribe a beta blocker and a diuretic, because minoxidil is causing, I think it is not, it is causing tachycardia. Sorry, it is causing tachycardia, not bradycardia. It is causing tachycardia. From that time onwards, I am making mistake. You should have told me, no. It causes tachycardia. Tachycardia means increase the heart rate. Okay. So along with minoxidil, always what we have to give? We have to give beta blocker and one diuretic, because minoxidil along with vasodilatory action, it is causing tachycardia and it is causing sodium and water retention. Due to that, we have to give diuretic. Clear this point? Now, now I'm going to tell you one important point. This is very rare point, important point, and competitive point. This is, everybody will not understand this point. Competitive point. See, ध्यान से सुनना सब लोग. Let me ask you one question. See, we have tablet form and we have topical form. Which form of these both is very effective for vasodilatory action? Who will tell? Anybody from the class? Understood my question? To solve this, let me tell you one point. See, when minoxidil is given, minoxidil minoxidil is very effective only in vivo. It is effective only in vivo. It is not effective in vitro. In vitro. In vitro में अगर दिए minoxidil, तो minoxidil is not at all effective. When it is given to the body in vivo only, it is showing action. Why? You know why? Because when minoxidil is given, minoxidil enters in the body, in the liver and in some tissues, minoxidil will activate. It should activate first. Actually, minoxidil is initially available as prodrug. Prodrug. This pro form of this minoxidil is not effective. It is not as potent as the active form. Okay. So minoxidil, what happens? Minoxidil once enters into the body, this prodrug converts into active form, and this active form will show action. Clear this point, everybody? Minoxidil body के अंदर activate होने के बाद ही it will show its action. Now tell me, tablet form is effective or topical form is effective? Who will tell? Any other answer? Tablet form is effective or topical form is effective? See, this tablet form and topical form, both the forms are, they are considered as in vivo only. टॉपिकल फॉर्म में दिया, डर्मल टिश्यू में अंदर अंदर जाएगा और फिर एक्टिवेट हो जाएगा. टॉपिकल मींस इट इज नॉट, टॉपिकल में जो भी अप्लाई करते हैं वो टॉपिकल स्किन के ऊपर ही नहीं रहता, स्किन के ऊपर से इट विल ऑब्जर्व इनसाइड, इट विल एंटर इनटू सिस्टमिक सर्कुलेशन आल्सो. सो याद रख लो, it is a, that's why I'm telling it is a competitive question. When it is given through tablet form, it will show its action, and in topical form also it will show its action. याद रख लेना. ओके. टॉपिकल फॉर्म में अगर ज्यादा ज्यादा सॉल्यूशन अप्लाई कर लिया तो स्किन के ऊपर, from the skin, just imagine this is the skin. Okay. When you apply minoxidil solution, minoxidil solution slowly enters into the dermis epidermis, and slowly what happens? It will enter into blood circulation. It goes into blood circulation and it can cause vasodilation. Because once वो in vivo means एक बार टिश्यू के अंदर चले गए तो it starts its activation. इट विल बी एक्टिवेटेड वंस इट इज एंटरिंग इनटू द टिश्यू। ओके, ऐसा नहीं है कि हर एक टाइम पे वो लिवर में ही जाना है, इन अदर टिश्यूज आल्सो इट विल बी एक्टिवेटेड, ये चीज याद रख लेना। मिनॉक्सिडिल इज इफेक्टिव इन वाइवो, इट इज नॉट इफेक्टिव इन विट्रो, ये चीज याद रख लो। क्लियर? नाउ let us now try to discuss about the therapeutic uses therapeutic uses of minoxidil। अभी आपको अभी तक समझ में आया होगा, minoxidil is a vasodilator, okay, it is causing tachycardia, it is causing sodium water retention, okay। See, in hospital mainly minoxidil is used as antihypertensive agent, especially in hypertension crisis or in patients who are not responsive with two or three antihypertensive drugs. If two or three antihypertensive drugs are not effective, then only we have to go with vasodilators. I already told. This is one therapeutic use. Next, minoxidil is very effective for hair growth. Hair growth. अभी तक इसका main reason we have not found, but therapeutically what happens, this when minoxidil is applied on the skin, especially when patients are having baldness or alopecia. Alopecia, there is a condition called alopecia, बाल झड़ जाता है ना, that is called alopecia. Hair fall is called alopecia. If anybody has alopecia in that conditions, especially see alopecia mein we have, there is one very famous condition called alopecia areata. Alopecia areata. Just imagine this is a skin, okay, all over the skin we have hair, right? We have hair all over the skin. See, alopecia areata is the condition at particular areas hair growth will not be seen. बाकी के दूसरे जगह पे hair growth रहता है, but at particular areas hair growth is not seen. That is called alopecia areata. Understood? So at some particular areas hair growth is not seen. So in these conditions, when minoxidil is applied in these areas, it will potentiate the growth of hair. Because of that action, minoxidil is available as topical topical solution and topical spray. अगर आपके पास कोई बंदा आएगा, सी वी आर डॉक्टर्स राइट, इफ एनीवन कम्स एंड टेल्स यू दैट आई एम हैविंग हेयर लॉस, आई एम हैविंग alopecia areata, can you please suggest me something? So in that cases you can suggest them minoxidil spray or minoxidil topical solution and tell them don't apply wherever possible. If see minoxidil अगर दूसरे दूसरे जगह पे लगा लिए ना, तो वहां पे it can cause hypertrichosis, एक्सेसिव ग्रोथ ऑफ हेयर हो सकता है। ओके, फेस के ऊपर अगर लगा लिया ना, तो फेस के ऊपर पूरा बाल उग जाता, hypertrichosis will happen. So wherever alopecia is there, in that places only we have to apply minoxidil. Understood this point, everybody? समझ में आया कि नहीं? Let me revise. See, minoxidil is a vasodilator. Its mechanism of action is it is a potassium opener, potassium channel opener, and when potassiums are removed out of the cells, it will cause hyperpolarization. I think secondary students don't know what is depolarization, what is repolarization, what is hyperpolarization. पता है आपको depolarization, repolarization, hyperpolarization? Do you know this point? Depolarization, repolarization, hyperpolarization. Yes or no? Okay. When minoxidil removes the potassium, it causes hyperpolarization, and with that it will relax the smooth muscles of the blood vessels, and with that it causes vasodilation. This is the mechanism. Okay. And one more point, minoxidil is available mainly through oral route. It is available as oral tablets. Once minoxidil is taken, when it enters into the body, it will activate, and active form will show its mode of action. Okay, it will cause hyperpolarization and it will relax the blood vessels and it causes vasodilation. And along with vasodilatory effect, what minoxidil does, it will cause tachycardia, and it will cause sodium and water retention. So because of this extra effect, when minoxidil is given as tablet, always remember we have to give beta blocker and we have to go with diuretic. This is important point. And in adverse effects, if we see in adverse effects, what will happen? It causes hypertrichosis. Hypertrichosis if it is applied on uh, places wherever hair is not required. and it causes hypotension. Hypotension, it causes hypotension, and sometimes it causes tachycardia, and it causes sodium and water retention if it is not given along with diuretic. Okay, so these are important points you have to remember about minoxidil.